The healthcare industry is on the brink of a revolution, but it's not without its pitfalls. Bold predictions suggest AI could slash healthcare costs by up to $360 billion annually. Yet the path to achieving this is riddled with challenges. Here's the catch. While AI promises to transform productivity in a sector historically plagued by inefficiency, the same misaligned incentives that have long hindered progress could derail its potential. But here's where it gets controversial. Could AI end up inflating costs instead of cutting them? Let's dive in. A groundbreaking 2024 economic study, https://www.nber/c/14760, paints an optimistic picture, suggesting AI could deliver massive cost reductions without compromising care quality. Imagine the relief for employers, consumers, and taxpayers if this becomes a reality. AI's applications in healthcare are vast. From streamlining diagnostic imaging and identifying complex conditions faster to eliminating redundant tasks, preventing unnecessary payments, and even identifying promising drug compounds more affordably. These aren't just theoretical benefits. Healthcare providers are already leveraging AI tools to achieve these goals. But here's the part most people miss. AI is a double-edged sword. While patients and payers stand to gain, hospitals, physician practices, and insurance plans are equally poised to use AI to maximize their revenue. For instance, AI scribes, which save doctors time by converting audio notes into electronic health records, are also being used to ensure every billable service is captured, sometimes leading to higher insurance claims. A recent report, https://www.statnews.com/use doctors health insurance bills may rise, highlights how AI scribes are outperforming humans in revenue maximization. Similarly, Medicare Advantage plans are likely to use AI to boost their adjustment scores, increasing their payments from Medicare. And this is the part most people miss. AI doesn't address the root problem in healthcare: weak incentives for cost control. In employer-sponsored insurance, higher costs are partially offset by federal tax breaks, while in traditional Medicare, providers earn more by delivering more services. If AI eliminates unnecessary care, provider incomes could plummet, making it more likely they'll use the technology to justify more, not less care. Insurers, though seemingly incentivized to control costs, often prioritize broad provider networks to satisfy employers and workers who care more about access than affordability. So, how can AI truly drive cost reductions? The answer lies in aggressive government and employer intervention. Employers could use AI to analyze pricing data and identify cost-saving opportunities for workers. But that's just step one. Step 2 involves redesigning insurance plans to reward workers who choose lower-cost, high-value care options, sharing the savings through reduced premiums and cost-sharing. The government should mirror this approach in Medicare, either through regulatory changes or congressional action. With patients incentivized to seek affordable care, providers would be more inclined to use AI for cost-cutting strategies. For example, AI could design care plans for complex patients that minimize overall costs or deliver proactive preventive care for high-risk individuals. Healthcare is drowning in underutilized data, and AI could harness this to prevent costly issues before they escalate, improving outcomes while reducing expenses. But here's the kicker. This transformation won't happen if stakeholders cling to the status quo to protect their profits. Congress must rethink how to ensure AI fulfills its promise in healthcare. The key: rewarding providers who use AI to cut costs with expanded market share, not revenue loss. Thought-provoking question for you. Should AI in healthcare prioritize cost reduction for patients, or is it inevitable that providers will use it to maximize their own profits? Share your thoughts in the comments. Let's spark a debate.